we're going to talk about the need to play defense in this Congress. So I think over the last few years, I think a lot of our supporters, medical cannabis advocates, maybe have taken a step back from engaging in policies at the federal level. And to be honest, not much has happened, right? There was, several bills that were introduced around um, banking issues that were likely not going to ever pass, some adult use legislation. And then, every year we've been able to pass the amendment that stopped the federal raids by prohibiting Department of Justice funding. But this session of Congress is a little different, not just because of the change of power, but I just want people to understand sort of the landscape. And I'm calling on our members and supporters to kind of wake people up that actually, the ball's in play, and we're actually starting this Congress actually in a defensive mode. So this organization, we are a patient focused organization, but we bring together various stakeholders. And our goal is to create a national medical cannabis program. And so, as we look at sort of all of the pieces on the chessboard, I hope that you're inspired to tune in and to start making your voice heard in Capitol Hill. So the first thing I want to bring to your attention is that last session, and this is a little busy, but we'll dive a little deeper into this. But there was actually a couple amendments that passed on the House side uh, of the CJS appropriations. Now that is the spending budget for the Department of Justice. And for over a decade, we have passed an amendment that prohibited the Department of Justice from enforcing federal cannabis laws in states that have medical cannabis programs. And actually, for the first time since we passed, there was actually a crawlback that was passed on the House side that would put those protections in danger, as well as an amendment to stop the rescheduling process. And with the election and the change of power in the Senate, not only do the Republicans now have the power of the Senate, but they actually have key roles that could actually advance this strategy in this session. We also, are seeing, as I mentioned, there were a few proposals last session around decriminalization and legalization that had some worrisome language, but we didn't really sound alarm bells because they were pretty far from passing. But with the sort of hemp issue coming to a head this session, we saw some legislation last session that could be pretty dangerous for medical cannabis that would actually put oversight of cannabis and cannabinoids in the FDA, modeled after the Tobacco Control Act. And I'll go into a little bit more detail about why that is dangerous. We also, despite big news in the last couple of years around, HHS, finally confirming that there's accepted medical use, a lot of the media focus was not on medical, was actually on adult use, and we started seeing this framing of this crisis in America of people using cannabis more often than alcohol, which is a crazy comparison, and public health crises that actually have nothing to do with medical cannabis patients. And in fact, if you have an analysis and can understand that there are at least 6 million medical cannabis patients, daily cannabis use makes sense, right? This idea that that anyone who is using cannabis every day has cannabis use disorder is partly because people just don't understand medical use, but also that medical cannabis and medical cannabis programs weren't really a part of the dialogue. And so we're entering this Congress, sort of in a defensive mode about the safety of cannabis, and not a focus on the fact that there's accepted medical use. So a lot of people felt that there's something that's going to happen from Trump that is going to protect our programs or somehow advance medical cannabis. And under the last Trump administration, what happened was actually nothing happened, really. I mean, his attorney general removed the protections, the only protections for the adult use market, which were never replaced. So right now, the adult use market is as completely at the whim of POTUS, of whether or not the Department of Justice wants to implement federal cannabis laws. But the reality of what that office can do is pretty limited. So even though he said he supported rescheduling, supported legalization, obviously the scheduling of cannabis is a key component to any sort of advancement of legalizing or decriminalizing cannabis. And the executive office, the president's office, actually has no direct power over the Controlled Substance Act. He can, he can tell Congress what his thoughts are or his wishes, but there's nothing he can do directly from his office to change the scheduling. We also have in the background the Project 2025, which if you haven't read this 900-page document, there are several concerns that we should have around our medical cannabis programs. And one of the biggest concerns is their view of basically reinvigorating RICO and, acting as, Big Papa in the states and, in areas where they don't agree with state laws or how they're, implementing laws like, drug laws, that they should intervene. And in fact, it goes so far to say that they should actually, rigorously prosecute interstate drug activity, which, supposedly, our programs don't have interstate commerce, but we know that some of that happens. But they also talk about doing something that has really never been done at the federal level very often, and that is, prosecuting simple drug charges. So with this sort of in the background, makes a little nervous. And I think, I think my sort of faith in in Trump's commitment to cannabis was, the appointment of Derek Maltz, who will be leading the DEA now. And, he has not been shy about his feelings about cannabis. These are some of his Twitter posts. And I mean, luckily he's not very popular, but this definitely shows what his attitudes are around cannabis. And in fact, he's even in the past blamed a school shooting on cannabis. So, he saw this whole rescheduling process as, a political move by the Biden administration. But this is who is now leading the DEA. And we saw, both from, the lack of medical cannabis being a part of the conversation in rescheduling, we saw an opportunity for, a resurgence of the anti-cannabis sentiments in this country. That, because the media was really just focused on, the impact of rescheduling for big businesses, or that it was a ploy of the Biden administration, that created two sort of opportunities for opponents. One is, the Sam and, some of the other anti-cannabis groups to, point out that this was only going to help big business, that's what the media was reporting. And that this idea that this was a political ploy. And so during an election season, obviously, there was a lot of opportunities for Republicans to band together. And again, we saw that impact in, the amendments in the CJS amendment. So I'm just going to dive into this a little bit more. So the amendments that were passed last year They got wiped clean because the entire appropriations process got pushed to this session, which now the deadline is in March, March 14th. But they did pass, two amendments, one that would block any of the rescheduling efforts by prohibiting the Department of Justice from spending any money on advancing that process. And then secondly, they added an amendment to our amendment that I'll show you now. So this is the amendment that would block uh, the um, the rescheduling process. And then what they did is they actually added a this B to our amendment that we've passed for a decade that said that actually there would be money available for the Department of Justice to implement this uh, paragraph, which is basically you've probably seen drug-free zones, those signs around schools. Well, what those actually mean is they're actually they show where 21 USC 860 is enforceable, and it means that any drug crimes, federal drug crimes that happen within those parameters, um, the punishments are doubled. And so something that would have a 5-year mandatory minimum would have a 10-year mandatory minimum. And in our state laws, we do have some of these zones, right, where we have kept licensing of dispensaries or cultivation sites or manufacturers, but it's definitely not this extensive. So this includes elementary schools, vocational schools, secondary schools, public and private colleges, junior colleges, universities, playgrounds, and housing facilities owned by the Public Housing Authority. And then there's this sort of extra area, which if they're in 100 feet of a youth center, swimming pool, video arcade, so these are obviously written in the 80s, that again, that the fines and the punishments would be double. And so, I think not a lot of people made noise about this. I think part of it was because that we had allies on the Senate committee. Um, but now, there are, the last of the very anti-cannabis, I would say, are in charge. And so for instance, the day after actually the House Republicans passed this amendment, there was a letter that was sent to the Attorney General admonishing him for the Schedule 3 findings, and basically, uh, told him that he should pull back the proposed rule to change the schedule of cannabis to Schedule 3, and all of the senators that were on that list, except for one who actually did not run for reelection, are now in charge of the Senate, including the CJS committee. And so the possibility, if this passes again in the House, of it ending up in the final appropriations is much greater. And I think especially with this not being on anyone's radar, right? That there was not a lot of news, there wasn't a lot of um, outrage as much as we tried to stir up some. And so for people who don't remember what life was like before the CJS amendment, there were hundreds of raids and thousands of people were caught up in these. There were prosecutions. There was over 480 years of prison time that people served for providing cannabis to patients. And this went across all of the administrations, including, it actually was at its height in the Obama administration, where a lot of people thought that he had stopped the raids. Uh, we actually saw the greatest amount of activity under Obama. And, this, if you think about, this graph is definitely kind of bringing down, the numbers. This is a way to look at this through the financial cost. But, I slept with my cell phone next to my ear until we passed the CJS amendment because I was the on the list to be called to sort of to launch our raid response plan. For each of these raids, this destroyed endless lives, put people into debt, separated families, and affected and interrupted access for patients. And so there's this sort of view that, the toothpaste can't go back in the tube, or, that this view that things are only going to get better for cannabis access. But I think that, this is a very dangerous and tenuous time for medical cannabis policy. Looking at, the Farm Bill reauthorization, which will be coming up in September, we know that the DEA has had this view that all of these cannabinoids, like THC delta 8, that they're Schedule 1. And so the reason I think that's important is that as we're moving forward, getting to the Farm Bill, I think we're going to see a lot of DEA lobbying activity, pushing back on any access of cannabinoids through that process. Um, you know, we also have this sort of danger around medical cannabis policy that while we know that, 90% of the country supports medical cannabis, that there's been a sort of framing that the goal of medical cannabis is adult use. And the reason that's important is that, first of all, there isn't 90% support for adult use cannabis, but also it's just not true. And it means that we're not able to evolve and advance federal policies that would actually allow cannabis to integrate into our healthcare systems. And so the other sort of issue that we're dealing with right now is that um, the DEA hearings around the rescheduling of cannabis have been postponed. And, part of where there's a legal process that is moving forward. Um, uh, some of the people in the case actually postponed the case, but, it doesn't necessarily, with the new DEA director, they don't actually have to move forward with these hearings. And so the Schedule 3 recommendation is really up in the air of what's going to happen next. So the DEA could actually put out a new request for a hearing. They could actually decide not to have a hearing at all and just decide, make a ruling of what schedule they think cannabis should be in. But the biggest challenge around this process being held up is that historically, members of Congress, if they're, if cannabis policy is being decided somewhere else, then they don't put it as a high priority on their radar, right? In a way, they say, well, there's the rescheduling hearing. We'll see how that plays out. And we actually saw this in the Obama administration with the Department of Justice notices, that a lot of members of Congress thought that Obama had ended the state federal conflict. But that wasn't the reality. And it actually, we weren't able to introduce any legislation around medical cannabis for about 3 years in the Obama administration because of that sort of sentiment among Congress that it was being taken care of somewhere else. So if you would like more information about the rescheduling hearings, you can go to our blog. And we're keeping, an eye on those hearings and updates with the details of that impact. As I mentioned earlier, the sort of legislative trend towards trying to put cannabis or cannabinoids in the FDA and regulating like tobacco. And there's two major challenges there. For medical cannabis, in a way, that's sort of the end of the work that we've been trying to do, right? Part of why we went to the states to create these access programs, part of that was because of the scheduling, but the other part of that was because of the fact that there's not a pathway for medical cannabis at the FDA at this time. And, the reality of, FDA regulating cannabis like tobacco would mean that we would see many of the products that are currently available for patients and in these markets taken off of the shelf because of the high standards that they would put forward. So I think going into this administration, one of our big fears is that, specifically Americans for Safe Access, we have worked for 23 years to change the scheduling of cannabis. And what we weren't working towards was to remove the sort of barriers of the Controlled Substance Act to then be stopped or prohibited by FDA from moving forward for medical access. And so really, when we look at the state experiment, um, you know, the uh, the fact that and it's not just cannabis, that there is not a pathway in currently at the FDA for complex botanicals. And it has nothing to do with, making cannabis better. It's actually has to do with our ability to understand what cannabis is doing in our body. And so the restrictions that we found are actually what sent patients to the States to look for access. And in the US, unfortunately, FDA approval is synonymous with medicine, and it's just not accurate. But what that means is that the FDA approval is really what opens the door to access to the healthcare infrastructure. And what we know from the state experiment is that while many people have access through the state programs, many people are left out. And that is for a variety of reasons, including that they can't afford these products without healthcare insurance, but also, the lack of education of their doctors, of hospitals, um, of healthcare facilities to understand why these patients need medical cannabis. And so, as I mentioned, the FDA, says that the only way that cannabis can be a medicine is if it goes through the FDA drug approval process. And they actually point to the botanical drug development process as an avenue. But this is actually, disingenuous because um, there's actually only been a few drugs that have made it through that process since 2004, and they were all single compound extractions. And I actually need to update this. There's actually 3 drugs that have made it through. But also within the actual document, the botanical drug development document, the FDA admits that this is not a process for a multi-compound, multi-target substance. And so, the other, challenge I think that we're looking at is looking at the funding for medical cannabis research. So this little complicated slide just shows that, there has been actually about $1.4 billion spent by NIH for around cannabis research. And 1.2 billion of that is actually spent on researching the harms of cannabis. And this is despite, government documentation like the Institute of Medicine report in 1999 that suggested, investments in research for medical cannabis. In 2017, the National Academies of Health found that there was conclusive evidence of cannabis being useful for pain and other conditions, and actually created research suggestions and priorities that were never funded. And then, of course, we passed the Research Expansion Act in 2022 that is yet to be, the second part of that, which was actually creating a research priority map and funding it, has not happened. And if we look at the sort of conversation that we had last year about sort of public health crisis in cannabis, I think there's a real fear of us never seeing the investment in cannabis for therapeutic benefits, and instead a lot of the same players that were studying the harms under prohibition to be given funds to continue to study the harms under public health threats. And so, we know right now that the current situation is not attainable for a lot of businesses who are struggling under these state models. And it's not, the adult use markets aren't working for patients. And so we're not in a situation where status quo makes sense for anyone. But advancement, we have some challenges, especially looking at some of the misinformation and lack of understanding that we have in Congress. Last year on our lobby day, we brought patients to DC and we learned that a lot of our allies thought that Schedule 3 was going to take care of everything, or they thought that the adult use markets were taking care of patients. And this means that they're not helping look for solutions for medical cannabis. So the other side of that is that we're starting this session with this fact that, FDA and HHS did find that there is accepted medical use for cannabis. And as we approach Congress with solutions like our legislation of creating an Office of Medical Cannabis and a new schedule for cannabis, we're not alone in this approach. The Congressional Research Service, as they were helping Congress wade through some of the options, actually said that, so one of the options was that Congress could create an alternative regulatory framework, and that they could create a new schedule. So our proposal isn't completely out of left field. And we know that there is bipartisan support for Congress, for cannabis. But the reality is that they're just not hearing from patients. And so if we can build on some of these successes by educating Congress and explaining, some of this news that they're hearing about, the daily cannabis use in this country, that a lot of it has to do with the medical cannabis program, right? That we know that people are substituting prescription medications like opioids and sleep aids and muscle relaxants for cannabis. And, doesn't it make sense that that is some of that reporting, right? But that also, taking medication is not abuse, right? There's no such thing as muscle relaxant use disorder, right? That these are patients, using cannabis and, improving their quality of life, and research is backing that up. We now have every state but Idaho, and every territory but the Samoas that have medical cannabis policy. So every member of Congress, cannabis debates are happening in their backyard. And we really need to educate members of Congress about the realities of what Schedule 3 would actually do, or any change in scheduling. But we know that, within the framework of the opioid epidemic, that we have more medical professionals that are considering cannabis. We know that there is a health crisis in front of us that, cannabis won't solve, but definitely medical cannabis is showing that it can improve. And we now have, 2/3 of clinicians in this country support medical cannabis, but only a quarter of them are recommending cannabis. But again, we're not standing alone. So we're calling on advocates to make sure that our voices are heard. We have a Patients First campaign. We're running through the first 100 days of the Trump administration with asks of things that he can actually do, like changes at HUD or the Veterans Administration. You can find these actions on our website. There's also, new members of Congress, along with, our the returning members that need to hear from patients. So we'll be sending out actions for you to reintroduce yourself or introduce yourself to the new Congress and let them know that you're here as a resource, and that you are a constituent and you care about cannabis. We will be introducing our legislation in this session, and also working with some key offices to get reports and other things that will help show support for that legislation. So we have campaigns that we're asking for endorsements of our legislation. And again, you can find this all on our website. If you need more information about the legislation, we've created this FAQ page, the MCA 411. So it's really deep dives in some of the issues that may be new to you as a medical cannabis advocate. And we have, tools to help you with talking to members of Congress, talking points, things that you can leave behind. Even though the hearing is postponed, it looks like we're going to hold our own hearing. So if you'd like to testify in the People's Medical Cannabis Scheduling hearing, please sign up. And look for announcements this week and early next week around Medical Cannabis Awareness Week. This is February 15th through the 22nd, and we'll be doing lots of public education activity. And this video, as well as any of our other webinars, you can find on our YouTube page. Please subscribe when you're there. I know I'm supposed to say that. And again, on our website, you can find resources for any of including the legislation or any of the actions that I just talked about. So thank you for spending your lunch hour or half of your lunch hour, hopefully, with me. And we will see you next week.